These are some different exercises you can do to exercise your head, your neck, your trunk, and your arms. When you have swelling in your arms, these exercises are good to encourage the lymphatic flow and your circulation. These exercises can be done if you have bandaging on your arms or a compression garment, and the exercises will actually be more effective if you do have some type of compression on, so that is encouraged. The first exercise is just doing some deep breaths. I would recommend doing 5 of these. So you're gonna go in through your nose and then out through your mouth. And I would repeat that 5 times. If you feel like you're getting dizzy or nauseous or you just don't feel well with that exaggerated breath, then go ahead and stop. But again, in through your nose and then just a nice exhale. Again, these are just slightly more than a normal breath. So after you repeat 5 of those, the next would be doing just some simple neck turns. These also encourage the lymphatic fluid drainage. So you're gonna go look over your left shoulder and then over your right shoulder. You just hold it just for a little bit to get a better stretch than maybe normal. You're gonna repeat each one 5 times on each side. So again, you're looking over your left shoulder and then over your right shoulder. If this makes you dizzy at all, you're welcome to stop and then continue on. And every time you turn, you just want to try to get a little bit further, looking over your shoulder. After the neck turns, you're going to do what we call trunk rotation. You're essentially doing the same motion, but you're moving your whole trunk and your chest. So you're almost a twisting. So you're going to twist side to side. I like to use my arms as well because it gives me a little bit better stretch. So you're turning each side 5 times. Again, if you feel dizzy, you may stop and take a break. If you feel like you can go further each stretch, go ahead. But if you feel like you're just comfortable where you are and you don't want to aggravate anything, then just leave it right in the position it's in. The next exercise is going to be just raising your arms in the air. You can do this 2 arms at once, or you can do 1 arm at a time. I will show you 2 arms at once. You're just simply raising up as high as you can go and then lowering down. So if you can only get your arms up this high, that's just fine. You're just raising up and down 10 times. So I'm going to go up to my full range of motion, which is just about next to my ears. If you have any shoulder pain, don't go that far. You can just kind of put your arms just to where that pain just maybe barely starts. And this is a slow motion. You don't want to go too fast with this because it could injure you. And if you have any shortness of breath or you just don't feel well, then just you can go ahead and stop and catch your breath and see if you feel better to continue. Following that exercise, we are going to just bend your elbow up and down. You can do both arms at once or you can do 1 at a time. We're doing 10 of these. Again, just a gentle, slow motion. You don't need to do a weight, just moving your own body weight is exercise enough. And this is going to help get the circulation moving and improve the lymphatic flow, which is causing some of the swelling. And the last exercise is just simply called hand pumps. You're just squeezing your hands and opening. And you can just relax your hands down if you want, or you can hold them up. But you're just doing 10 hand squeezes or hand pumps. If you have your hand wrapped because you're in compression treatment, then you might not be able to go as far, but just do what you can to move the lymphatic fluid in your circulation. If you want to watch this video without the direction, you can go ahead and just turn off the sound next.